Hello, I'm David.
And I'm Debbie.
And I have stage 4 cancer.
And I am his wife and his caregiver.
And today we're going to share with you the questions we feel you ought to ask your doctor. Now this is following diagnosis, but before treatment begins. And we've written these down actually on a script, and we're going to make these available to you. And you ought to write down your own questions and take them with you to the doctor.
Absolutely. So this is our top 5 list. Question number 1. Doctor, what exactly are my treatment options? And what are the pros and cons of each one of them? And what's my life expectancy with and without these options?
You know, the first question I asked was, well, how long do I have? And that's what you tend to ask. But you need to learn about each one of these treatments and what they will involve and what you can expect from each one of them. And therefore, what are the pros and what are the cons of each of them?
And honestly, it really helps to have another set of ears as you're going over this. And we encourage you that on the piece of paper you take to the doctor, make notes so that you'll remember, because it's all kind of a blur.
Question number 2. Doctor, I've heard about palliative care. I'm not sure what that is. Will you be referring me to a palliative care physician or a palliative care nurse?
So the palliative care team is your best friend. They are the ones that focus on your comfort, not necessarily your cancer. And so they're going to help manage your comfort, your pain, and your symptoms. And they are the experts in it.
And you can have the palliative care at the same time that you're getting very aggressive treatments. They are not separate from each other. They can occur simultaneously.
And talking about side effects, the next question, number 3, is, Doctor, if I choose the treatment, what are the side effects of each one? And when can I expect those side effects to occur, and what in the world do we do about them?
And these side effects are predictable. Your oncologist or your nurse should be able to tell you what to expect, and not only that, when to expect them. And that's extremely important, because when they just show up and show their ugly head, you know, you could feel like you're going to die. And so you need to know what they're going to be like and what you do for them.
And while each diagnosis differs and the drugs that you're given and the treatment regime are different, I'm going to refer you back to our video, the 21 days of chemotherapy, so that you get an idea, at least if your cycle's 21 days, what to expect. But no matter the cycle, no matter the drug, ask about your individual situation.
Question number 4. Doctor, how much is all this going to cost me?
You know, this is a big question, and healthcare is probably the only area in our life when we push a cart into Walmart, let everybody else dump whatever they want into that cart and not know what it costs. And we just pull up to the cash register and pay the bill.
So ask a social worker. They are there to explain to you insurance if you have it and what it will cover, or what happens if you have no insurance.
And finally, question number 5, and it's an important one. Doctor, who is going to be my quarterback? Who is going to manage all these different people and all these different aspects of my care?
Most likely your oncologist, the one you see the most, is going to be the quarterback. But you also should hang on to your primary care physician and continue to see him or her for all your other health care needs.
Now, I have a hint for caregivers. Caregivers beware, because the reality of the situation is you are going to be the quarterback. You are the one that is there 24/7 with that person that you love. And you are the one that knows if the treatments are working, not against the cancer, but the side effects. And are they doing what they need to be doing? And do we need to call for help, or do we need to go into the after hours care? So caregivers, just accept the responsibility. Your job is to be the quarterback and to help manage the actual aspects of this care.
And you will know more about the treatment than anyone else, because you will see it from beginning to end, and you see all the people along the way. And you're the only one, only ones.
So ask your questions and be informed. Knowledge is power.
We started out with 20 questions, so we hope 5 is enough to get you started. So we hope these are useful, and
Go Tigers!
go Tigers!